Well, good evening, everyone, and thank you for joining us tonight as we talk with two of the founders of the parent advocacy group, Advocates for Mental Health, Michigan Youth. Thank you to those who are members and potential members of MHAM and who have joined us tonight and before. And if this is your first webinar with us, we want to give you a very special welcome. So welcome. We also want to let you know this webinar is being recorded, and you're welcome to drop questions in the chat or comments, and then we'll also open it up at the end of the presentation, and you can drop questions in the chat or unmute yourself to ask your question. If you need a certificate of attendance, please also drop your name in the chat, and I will get a certificate to you this week. We're grateful to have the opportunity to catch up with Michelle Massey Barnes and Rachel Cuschieri-Murray to discuss their current advocacy activities. Facilitating today's webinar is MHAM's President and CEO, Marianne Huff. Ms. Huff is an LMSW and has 20+ years of leadership experience, including 12 years of executive level staff leadership and advocacy within the behavioral health field. Prior to MHAM, Marianne served as the executive director of Allegan County Community Mental Health for 6 years and as the director of advocacy for the Ability Center of Greater Toledo in Ohio. Additionally, as an advocate at the Michigan Protection and Advocacy Agency, Marianne served individuals and families and helped them access mental health services and uses their personal lived experience to optimistically and passionately lead, advocate, and educate to improve the lives of those who struggle with behavioral health challenges and eliminate barriers to the timely and effective treatment of severe mental health. And here's a bit about our co-founders. Michelle Massey Barnes is a passionate advocate and parent with lived experience. Michelle became a co-founder of Advocates for Mental Health of Michigan Youth after facing incredible difficulties navigating children's mental health. Michelle and her husband have 3 children and find proper supports for different needs often feels like an impossible feat. Michelle's family enjoys watching Marvel Studios together, and Michelle promised MHAM she will not hulk out at tonight's discussion, even though she admits being a mental health advocate frequently requires the strength of a superhero, and we don't doubt that. Thanks for being here, Michelle. With us also is Ms. Rachel Cuschieri-Murray, and she is the executive director with Eaton Conservation District and also a passionate advocate for her children and others who deal with serious emotional disturbances, which you will hear throughout this webinar referred to as SED. Okay, Marianne, the floor is yours.
Okay, well, thanks. Well, welcome everybody. It's nice to see everyone. Thanks for joining us. It's been a minute since we've had the opportunity to catch up with Rachel and Michelle, and unfortunately Laura couldn't be here, but we had the opportunity to talk with these ladies last year. A lot has happened, but just quickly I want to sort of briefly talk about, in case folks aren't aware, the way that I got connected with Michelle and Rachel was actually through the Kennedy Forum, through a guy named David Lloyd. David Lloyd sent me a series of emails that Michelle had sent to him in January of 2022 when she was seeking services for her daughter. And that was really how we got acquainted with each other. And I have to say that it's been a whirlwind ever since, I know, especially for them. So I really want to thank you, Rachel, Michelle, for joining us this evening and giving us some updates. I think one of the things I'd like to do is, I'm not sure how many of our viewers are familiar with the work that you and your organization does, but I'm wondering if you could just kind of speak about how you got started and, you know, kind of like, what are you currently doing?
I guess I'll jump in. First of all, thank you so much for having us. You guys are awesome, and we really appreciate your partnership and appreciate you giving us an opportunity to share what we've been doing. So your question was basically 101, what are we doing, right?
Yeah, kind of like how you got started, and then a little bit about, you know, what are you doing today?
Sure. So we got started with a lot of frustration and aggravation and overwhelm because we were working so hard to advocate for our kids and we weren't getting anywhere. And then thank goodness we connected with each other, and all three of us were, I guess, the type of people who weren't going to just sit back and watch this happen to our families. And when we realized that we were all in the same situation and that this was much bigger than us, we also decided that it was worth it to make sure that other families weren't going to go through this alone either. So the first step was creating a Facebook group, and we launched that in February of 2022. So it's been a little over a year and a half. We have well over 700 people in that Facebook group now. And these are all families like ours that are struggling to get services and treatment for their children who are suffering from severe emotional disturbance, or SED. And we don't like that term, but it's the one that's used. So that's how we refer to it. And we've been knocking on doors and sometimes kicking down doors and busting in where we weren't exactly welcome and pulling up chairs to tables that we were not invited to, and making sure that we are speaking out and finding inroads to have our voices heard and change the system where we're able. So I think that's the kind of the nutshell of what we've been doing, kind of from a broad point of view, but I'll let Marianne talk about specifically how we've been doing that.
Thanks, Rachel. That was a really good summary. We have been kicking down some doors, and we have been inviting ourselves to some tables where we maybe aren't so welcome, but we're parents who love our children, and we want the best treatment for our children that we can get for them and that they're entitled to. So this is really important work. We are working together in a lot of ways to work systemically. That would be working with state representatives, with senators, working with other advocacy organizations. And also as a group, we work together as families and as parents to support each other, to give each other resources. Recently, we had a group member say that we should have a conference topic on things that you can't learn through the mental health system, but other parents in our group can share with you to help you find your way. And I think that is really, really true. There is a lot that comes with lived experience, both in terms of what it's like to go through this, but also in terms of how to navigate with the skills of an advocate, and how to keep trying to get the help that your family needs.
Well, thank you for sharing that. I want to echo that. I think that the work that you do is very important. And I know that I've had the privilege of working with you and with some of the families that you have referred to me as an advocate to try to assist them. So because of your experience, and while 700 is a lot of families, actually, when you think about it, can you talk about some of the ongoing challenges that you're seeing and experiencing, and barriers that you're hearing about from families?
Yes, it hasn't really changed since we started talking about this a year and a half ago. Children with severe emotional disturbances, whether or not there is a co-occurring developmental need, it's very difficult to get treatment for them, especially in the public mental health system. I think severe emotional disturbance is misunderstood, and it is often treated as if it is the result of bad parenting. So even as our children struggle, as they become more and more hopeless, as our families break apart, as our children attempt suicide, get involved with substances to self-medicate, as they become aggressive and homicidal towards others, we are repeatedly treated like this is our fault because we don't have basic parenting skills. It's not true. This is a disability, and it does not represent the best of our children. It represents the parts of our children that are sick. It represents the parts of our children that are distressed, and the parts of our children that need help and support and treatment, because our families don't have to be ripped apart. So what we find is you can't get help anywhere. The situation continues to escalate, because that's what happens when situations are unstable and there's no help. Things get worse. Eventually you start going to emergency rooms. Eventually emergency rooms start telling you, we can't help you. It's too severe. Take your kid home. No hospitals will admit your child. Community mental health says, we don't think there's a problem. Well, what kind of services would you even want? Like, we're already giving you 1 hour of therapy a week. What else is there? We say, there's this entire Medicaid provider manual. And we get told often, we've never read the Medicaid provider manual. Advocacy is very hard. Advocacy is very hard. At some point, parents don't know what to do. We're truly worried that someone could die. I don't say that lightly. That's what we're truly worried about. And we're still met with resistance. At some point, our families are told, have your children arrested. You can get out of home placement through the juvenile justice system. That system has a bigger budget than mental health. They'll pay for residential treatment. That's not actually therapeutic treatment. But parents don't know what to do. And parents are routinely told, terminate your parental rights. Because although community mental health can't pay for intensive services, child protective services can open doors for your family, which also is not true. But if you terminate your parental rights, they will find placement for your children often, not always. And sometimes it's therapeutic, and sometimes it's less therapeutic. But these are the struggles. What do families do when there's no help? There is intense crisis. Parents are afraid. They have no options. And even as they pick from terrible and the worst decisions, they're judged for every decision they make and everything that goes wrong along the way, when really the truth is, with the resources we have available to us, it's almost impossible for things to go right.
Rachel, do you have anything to add to that?
I just feel like Michelle summed it all up beautifully. I do not have anything to add to that. That's what we are dealing with. I know several people on this call have personal experience with that and can attest to the risks and the dangers and what their families go through. And it is serious, and it's every day, and it's every part of the day. There is no break. We don't sleep peacefully at night. And so we need help.
Well, you bring up some very important public policy issues when you talk about the fact that in order for a child with SED to get appropriate mental health treatment, they have to go to the juvenile justice system in order to get residential treatment, which is clearly not the way it should work. We need to make policy changes so that the community mental health system can pay for children to be in specialized residential programming provided by sometimes child caring institutions, or what we call CCIs. Because in Michigan, the problem we have, as you know, both of you know, and a lot of you on this call know, we have outpatient and inpatient and not a lot in between, and that's the problem. And, my feeling is if we had good specialized residential programs in Michigan, then the need for acute inpatient care would probably be greatly diminished. Any thoughts about that?
I think you're right. I would even back up a step, and I would say we have a significant need for specialized mental health care in Michigan, even at the outpatient level. Because if we had that care, if we had consultations with experts in different areas of need, a lot of this could be prevented. We wouldn't get to the point where our families were in this significant of crisis. Like there is hope. Like there are good times and bad times, and many of these situations could be stabilized, but not without someone driving the treatment plan and driving the team who's experienced and knows how to work with the family and work with the youth and meet the needs. And then when it gets to the point where it's like the boiling point and you still have no one to drive the treatment and to meet the needs, you run out of chances. Like you run out of the opportunity to find someone who can help, and specialized residential becomes the only option left that has the ability to ensure safety. It's not even the option that we want for our children and for our families. Like it's devastating to send a child to residential, but the choice isn't send your child to residential or live a happy life. The choice is send your child to residential or risk so much. You risk everything, right? I feel like I so often hear it's traumatic to send kids to residential. It probably is, because it was traumatic for me. I can't imagine what it would be like to be the youth. I can't. But I can tell you that what was happening in our home was traumatic for our entire family, including the youth who was placed in a residential program. So we need it all. We need the treatment, the specialized treatment to start from day one.
Well, one of the things that you point to is something that as an advocate I've observed, and it's actually something I've been thinking a lot about, is that we need more expertise in knowing how to actually treat underlying trauma, because a lot of these young children and adolescents have significant trauma histories, developmental trauma, and throwing services that are designed to keep children and adolescents out of institutions like community living supports or peer supports or even parent support partners or respite. Those things are designed to prevent the need for being in a residential setting or institution, but actually they don't actually provide any treatment. And, one of the things that really has occurred to me over the last 6 months is that in order for, and this includes adults with serious mental health conditions, children, adolescents, is that in order for these individuals to be able to think about living independently in a successful way, the focus needs to be on healing the underlying condition, the reason for the behaviors and the symptoms. And I think our system is absolutely missing that in a huge way. I don't know what your thoughts are on that, but that's something that has really become clear to me, especially over the last 6 months.
I agree, Rachel. I don't know if you experienced this, but one thing that I'll add to it is oftentimes, even when you have wraparound in place, there are multiple providers involved, but they can all be working as in opposition to one another. The efforts aren't coordinated, so you can have one provider like driving the bus one direction and another driver driving it the other way, and you end up just swerving all over the roads and right back in crisis. I don't know if you experienced that or other things like that, Rachel.
Yeah, I didn't experience that in particular, but everything that y'all are discussing is resonating with me, and I see the nodding heads too. I think that these are universal problems, and folks are. I know I personally was stunned to find out that even people within the system don't know how to navigate it. And, they might have their little area that they feel that they've developed an expertise around, but when it comes to, the types of issues that our families experience, almost nobody knows what to do with those things. They don't even know where to refer you to. So, so it just really reinforces the fact that, the expertise isn't there, the referral service isn't there, the connections aren't there, system's not set up. And so families are left to flounder, and the best advice that they can get is from other parents who have been through something similar, because they've fought their way through the system, and they've maybe tried something that unusual, and that's that's what we do, is we try unusual things, and we poke around and see if we can make any progress in different ways, and then we share that information with each other, and we just try to plow new pathways that didn't exist before. But it's hard to do that when you're dealing with a system in Michigan that is so underdeveloped and underfunded for so long that it feels like a big gaping black hole.
It's such a good point, Rachel. And I think we see it in very concrete ways in safety plans that are actually templates with check boxes. And families in crisis get told things like, just call the police if you're in crisis, when we're actually asking for safety plans that identify what the risks are and help prevent the risks from unfolding. We don't want a completely reactive plan of just call the police. We want interventions. We want help forming stronger relationships with our kids, especially teenagers. Like, every teenager is kind of hard, you know what I mean? Like, and then you have these compounding relationship dynamics. We want help navigating those relationships dynamics, not blame for the fact that they exist. Our treatment plans are often, if you took the treatment plan of a child or youth with SED and you didn't know that the child had this severe emotional disturbance, it's often not identifiable in the treatment plan. The treatment plans are like so generic that they don't speak to what the needs are. And so the interventions aren't targeting the needs. And just like you said, Marianne, we're missing the opportunity for treatment. Like, we're missing the opportunity to skill build as a family and for the youth. And then what happens when that youth becomes a young adult? The skills aren't in place, and the whole family, and especially the individual, continue to suffer.
Yeah, and I just want to highlight, like, the cyclical process that you're bringing to my memory of how we just kind of go around in circles. Like, parents are kind of the experts because we know our kids better than everyone, but we bring that information to the professionals hoping that they're going to have some answers for us, and we often find that they cycle back around and then ask us what to do. Like, what should we do when your child does this? And we're like, we don't know. That's why we're here. We need your help. We need to figure this out. And it's really, really kind of unnerving and disturbing when we're put into that position. How do you create, if we were capable of creating treatment plans, of course we would.
Well, many of us have, right? We've actually,
right?
Many of us have created treatment plans for our children, and we're still ignored.
Yeah. Yeah.
That's
or
hard.
Safety plans were often, you sit down to create a safety plan, and then you find out that the safety plan really relies on just putting on paper what you've already been doing. And that's not enough.
Mm-hmm.
Nobody's got anything better for you. So yeah, we need to do better.
Well, and to your point, I think one of the problems with the safety plan is typically it's call 911 or, call the police, and then the police come, and then they have to decide, do we take the young person, the child, to the emergency room where they're going to wait for a long time, or do we take them to the juvenile detention center? I mean, that sort of becomes the two choice points, right? And so really, to your point about literally going around in circles, like on a hamster wheel, because if those are your only two choices, you know, and you have no other options, then, you know, it's kind of like what's the definition of insanity? Doing the same thing over and over, expecting a different outcome. You know, you're going to have the same outcome, and that's where there's a lot of problems. I'm curious, have you heard anything about the status of the mobile crisis units that CMHs were supposed to have available? Have you heard anything about that?
I've been tracking in my own area, and there hasn't been any changes in the staffing or the timing of it. I don't know, Michelle, if you've heard anything about other areas that are maybe more rural or something.
We are not hearing from parents. I called mobile crisis and they came out and they helped. We are not hearing that. I feel like in the last 6 months, there have been some parents that have said that they've gotten a response from mobile crisis, even if it's just merely an answer to a phone call. I feel like if we were to survey our group tonight, the group would strongly stand up and say it's not a service that we can utilize that is helping us when we're in crisis. I think a lot of times there's a misunderstanding with the mobile crisis teams as well, like what's needed here, how to work with the youth that is having this kind of significant escalation and is really unstable. I think there's maybe a response from the crisis team that it just needs, like, if it just checks a box and it looks a certain way, then the crisis is over. Whereas we often know that this type of crisis can go on for hours or even days. And what we really need is significant help with de-escalation, but then we also need significant help with assessment and figuring out what the correct level of care is. And crisis response with no care afterwards is really just an invitation for more crisis response.
So hence, that's why we need something between outpatient and inpatient. Someone was talking about, you know, crisis. Well, we have a couple things. One, crisis stabilization units, which are, you know, still in the midst of being created. Crisis stabilization units would actually be almost like a little mini emergency room for psychiatric crises where folks can go for 3 days and become stabilized. But the other thing that we don't see enough of is crisis residential programming that can sort of mitigate the need for, you know, inpatient treatment and mitigate the need for going to the juvenile detention center.
Yeah, I think the crisis residential is hard because there are very few options, but to my knowledge, and the providers do change, right? But to my knowledge, the residential crisis units that we have for youth, also they're not locked facilities. And if a child in crisis can leave if he or she feels like leaving, and then is walking the streets in a different city, I in crisis, like, I don't know how are we better off with that as our option. So sometimes the option that you have also doesn't really match the need. I mean, sometimes children, teenagers are in crisis and they run away, right? Like eloping or running away can be part of the need that needs to be addressed. So how do we bring the whole thing together and support the family through what the real challenges are? We don't have a very flexible system for meeting needs. I don't think we even have a very flexible system for honestly identifying what the needs are.
Yeah, interestingly enough, about just an interesting factoid about community mental health. Actually, yesterday was Community Mental Health's 60th birthday. It was on Halloween of 1963 that Kennedy signed the Community Mental Health Centers Construction Act of 1963 into law. That's how community mental health was born. Predicated on the idea that we had too many people, this was adults, with severe mental health conditions in state psychiatric hospitals that were not good places at the time. There really wasn't any what you would call treatment. And so the idea was, we now have Thorazine, so we'll get people out. I think that it's time for us, as you know, those of us interested in mental health public policy, to kind of take a long look at why CMH was created, but what's changed in the last 60 years in terms of mental health treatment in this country. I mean, we have a lot more knowledge about the human brain than we did even 30 years ago. I mean, there's a reason why the 90s is called the decade of the brain. But I think we need to take a long look at the quality of care, but also what is the actual mission of the system these days. Is it still really just about keeping people out of institutions? I don't know what your thoughts are, but to me, it seems like it should be more than that.
I think it should be more than that too, but sometimes I do think that it's very limited to that very simplistic view and approach. I don't think people understand how complex this is, or if they do, they don't want to deal with it, right? They just want it to be a simple and inexpensive solution. And a lot of times it's just, you need an individualized, not a lot of times, every time you need an individualized approach, and that's difficult and complicated. And you can't warehouse people and then expect them to do well. But that's really, the solutions of sending them to the hospital or sending them to juvenile detention, or these safety plans that aren't specific, like we were talking about, really are. That's why it's because we don't seem to be capable of creating that individualized, really specific, really nuanced treatment plan that Michelle was referencing earlier.
I mean, I agree with you, Rachel. I feel like I am fortunate to be someone who experienced two different worlds: community mental health and then also private insurance. I'm not suggesting that private insurance providers have all of the answers, but it was a whole different network of providers that we were able to choose between, and we did have choice. That's different than what we experienced at community mental health. And in my experience, when we worked with providers that were actually knowledgeable and experienced in the different diagnoses that our children have or have had, it was a very different experience. We went from a template, like here you kind of get this. We went from that to a very customized approach that not only was specific to our child, but was also specific to the diagnosis that our child had. That made such a big difference because the person understood the symptoms and understood how to work with the symptoms. And then over on the other side, we had providers that didn't have the same level of experience. And even though they were well intending, they were exacerbating the symptoms and things were getting worse, even as it was being called treatment. So you really can't take a one-size-fits-all approach or a this is outpatient, so we just do cognitive behavioral therapy approach. You really have to understand what what's the diagnosis? What does it look like in action for this youth and for this family? And something that I've honestly, I've never heard community mental health talk about, what are the best practices for treating it and for working with it? Like, why aren't we talking about that? I feel like instead families get treated like we're lucky we get anything. So how dare we want what's clinically best for a situation?
Well, it comes down to quality care. And as you said, there is a huge difference between getting services in the public system versus private system. And that shouldn't be the case. It should be great care, whether you have Medicaid, Medicare, no insurance, or private insurance. So, question, sort of switching gears for a minute here. We've heard about children being stuck in emergency rooms because there's no inpatient psychiatric beds available. Can you provide an update on that situation? Has that gotten any better? Anything you can share about that?
Yeah, no, it has not gotten any better. Unfortunately, there's no update. We're still seeing people spending days, weeks in the emergency room trying to figure out where to go from there. And I was talking to a provider not too long ago who was saying, she tells her clients that if they're in a crisis like that, you better make sure that you're ready to stay for at least 4 days if you want any hope at being able to get insurance coverage for a higher level of care that comes after a hospital stay. So and then we have people who are coming back from these crisis situations and not even getting a follow-up call from their CMH team. So, it's regardless of how they're trying to access the mental health care, they're not accessing it regardless of the payer. And there are no more beds available either. That has not been resolved.
Yeah, they can't solve the problem quick enough, can they? I mean, I know that Pine Rest got $38 million allocated to it so that they could create a whole campus for pediatric mental health. But, that was last year. That takes time to create. But again, I go back to this idea that we need something in between outpatient and inpatient. One more question, because I know that you are in touch with a lot of families struggling with this. It's my understanding that Hawthorne Center is being demolished. Matter of fact, I know it is because I was home visiting family on the east side, drove by there and saw the bulldozers bulldozing Hawthorne. My understanding is that these kids are now placed at Walter Reuther, which is an adult state psychiatric hospital in Westland. Actually, it sits right behind where Eloise used to be. Any comments or hear anything about how it's going for those children that are placed at Walter Reuther?
Not well is probably a fair place to start. The move itself was very poorly organized. We were told children got to Walter Reuther and their rooms weren't ready, and they slept on a floor in I believe the conference room, but I don't know for sure which room it was because their beds weren't ready. There were screws on the floor. Some of these children have threatened to eat objects like screws as ways to possibly self-harm. There's problems with parent visits. They've limited visitations to weekdays, 9 to 5. That's very, very difficult for parents that work, that want to see their children. There's no more weekend visits. We saw in the media that for months, the children were not allowed outside at all because the fence wasn't put up. I don't like supply chain was cited as the reason the fence wasn't put up, but the state had months to prepare for this. Like there's just no excuse to not have children able to go outside, but we're still hearing that they often don't go outside unless it is above 50 degrees and unless the shift nurse that day decides to take them outside. So I don't feel like it's changing, right? Like it's the problems that were at Hawthorne followed everyone to the new hospital, and they're still continuing just in different iterations and different versions of many of the same things.
Wow. It's really hard to believe that's happening in 2023, isn't it?
Yes.
Yeah, and I would add that we're also hearing a lot of reports from parents about restraints, chemical restraints, physical restraints, stuff that I would expect to hear out of Guantanamo Bay and not from a mental health treatment facility, right? Like these are torture practices. These are not things that are going to improve somebody's mental health. And there's no excuse. Like it would be inexcusable if these things were happening at a detention center. These children aren't even supposed to be being punished. Like there's just absolutely no excuse for some of the things that we're hearing. And another problem is when questions are asked, when these things are investigated, we get these stock explanations from MDHHS that, it's been investigated and policy was followed. Well, if policy was followed, then policy is flawed and it needs to change, because it is not okay that these things are happening. It is abuse. So there's still a lot of work to be done there.
I will say that under certain circumstances, restraint and seclusion is allowed depending on the behavior, but the question becomes, how is it actually being carried out? The mental health code is very clear about how that's supposed to happen. So that is a concern. If it's taken beyond what they're supposed to be doing, that is a big concern. My understanding is that the Protection and Advocacy, which is Disability Rights Michigan, is very involved in monitoring what goes on at the state hospitals, in particular Walter Reuther right now. So that's my understanding of that they are paying a lot of attention to what's happening there.
I think I would take it back even a step further, and I would ask what kind of training the staff have in therapeutic de-escalation. We can talk about whether or not restraints met the mental health code, but I think we also need to talk about what is happening to prevent the need for restraints. Like what is happening what is happening in situations where there is escalation? Are there therapeutic attempts being made to calm situations in ways that children can respond to with their clinical needs? Or are restraints and seclusion the only forms of behavior modification and safety intervention that staff have available? I feel like I'm hearing from parents at Walter Reuther, the parents of children at Walter Reuther, that restraint is being used as frequently as it is being used for some of these children because there's no other forms of de-escalation or therapeutic intervention taking place to prevent the need. So the only thing left is to restrain a child who is now at risk to himself or others.
If you have kids that have been transferred to an adult psychiatric hospital, which really prior to 2003, when the state closed Northville, was actually a geriatric psychiatric hospital. It was not even just for adults. It was adults, geriatric adults is what it was. And the reason I know that is because when I worked for Protection Advocacy, we monitored there. And so the idea of kids being placed there is a very frightening idea. And then if you imagine kids being in a situation where there's not appropriate place for them to be, they can't go outside, they're sleeping on the floor because their rooms aren't ready, I guess, who wouldn't be acting out? So if they were already acting out at Hawthorne because acting out of their mental health conditions, then one would expect that those certain circumstances would cause an increase in acting out behaviors or other symptomatology.
Yeah, we hear from parents that the food is really terrible. I'm not saying I have expectations that it would be 5-star restaurant, but terrible to the point where it's not edible. And there are children who are supposed to have double portions of food who aren't getting double portions of food. So we also have hungry children. Some of the children have told news reporters, like, because there's been so many children that left Hawthorne. They've said they've left because it was so terrible there. We have a young man who's been speaking with our group who was a patient at Hawthorne, and he said the only thing he learned from his time in Hawthorne was to never trust anyone and always watch his back. He has said staff would call him out of camera sight, and then things happen that shouldn't happen when they're out of camera sight. All of this is going on, and it is hard enough for parents to hear their children saying this, but I also think it's worth mentioning there's also children in Walter Reuther that are nonverbal, and how do we protect those children? How do we even know what's happening to those children? Like, this is a really big problem, because a psychiatric hospital stay should not negatively impact the trajectory of a youth's recovery. And yet that's where we are.
Completely agree with you. You know, that saying, the more things change, the more they stay the same. The issues of trying to provide treatment in state psychiatric hospitals has been an issue, of course, for hundreds of years, but it shouldn't be that way in 2023. The one thing I would say to anybody on this call that's dealing with that, or if folks watch it, is people really need to be filing recipient rights complaints with the state, because those rights officers that work in those state psychiatric hospitals, they work for the state. You definitely need to be doing that. And you also need to call Michigan, Disability Rights Michigan, because one of their main functions is to follow those abuse and neglect investigations in those state hospitals. So I really want to encourage people to make sure that you're doing that, because I'll put the number here. When I was there, that was part of my role, was to make sure that investigations that were done were conducted with integrity and in accordance with the rules. So some people really balk at administrative complaint processes, but it's what we've got. And if they get enough of them, you know, I would also suggest you file a rights complaint, send it to your legislator. I think legislators need to know what's going on, and then send the legislators the 30-day letter and then the outcome of the investigation as well.
I think that's a really good idea.
Thank you. I really think that's what needs to be done, is that, you know, keep flooding them with administrative complaints. I'm looking at the time. It's 6:54. We need to end at 7, but I want to see if there's anybody that has any questions. There's been questions coming up and comments in the chat that I've been responding to. But does anybody have a question that they would like to ask that we can try to answer?
You're welcome to drop those questions in the chat or unmute yourself and state your question.
See that Cammie raised her hand.
Hi, sorry, it kind of froze for a moment. Thank you, Rachel. Now, as Michelle and Rachel already know, my son passed away. It'll be 5 years on November 6th of this year. and he was denied care. I sent letters. I sent numerous letters trying to get help. So is there some kind of, how do I say, and the system is still the way that it is in many ways that it was years ago. The problems that I started having were in 2010, and we lost him at 17 in 2018. So I guess how can we really hold people who work for, let's say, CMH or DHS, how can we really hold them accountable when their supervisors and their managers are all sticking up for the people who are making these decisions to put our kids at risk, doing things like, for example, they wanted to arrest my 10-year-old son. And because I said no, they said, well, we're going to hold you completely accountable for what he did. So I guess, I'm sorry this is long, but my question is, what can we do when we're faced with these types of situations where we feel completely helpless and we can't protect our kids?
That's why, Cammie, I said it's really important to file those administrative complaints and then keep copies of them.
I did.
But I think that the only thing that actually creates change is when, what I've seen is when the media gets involved. And I think the best story, which is how the protection and advocacy got created, and I'll make it short because I'm looking at the time, is that there was a place called Willowbrook School, which some of you have probably heard of, and it was on Staten Island, New York. And even at the federal level, they knew the place was horrible. It was a hovel. And Bobby Kennedy was supposed to go see it, but he was, of course, assassinated in '68. And so finally, there were severe budget cuts in New York, and a young reporter named Geraldo Rivera got a key from a social worker and a psychiatrist and went in there with a camera crew and filmed what was going on, and it was disgusting. Yep. There was like one staff for 50 kids. They were naked. They were starving. I mean, this was in New York. That's actually how we got the protection and advocacy system. If you go on YouTube, you can see the documentary that they made about Willowbrook called Willowbrook 25 Years Later. I think it's only when we have the reality in a very long, protracted way where people can't deny it, that, you know, that we see change. I mean, the media, the movie The Snake Pit that came out in 1946 is the reason why we have the National Institute for Mental Health. So I just want to say, as an advocate myself, as the mother of a child who was an SED kid at Hawthorne 30 years ago, all I can say is I recognize, I want to affirm, this is incredibly frustrating work. It's incredibly difficult because the message that you end up getting is that your child is not important. But I also want to say that in my career, there's times I've worked on cases where we just kept throwing every administrative complaint at the situation and something finally did stick. We have had successes. And so I want to encourage you to keep, you got to be the fly in the ointment. You got to be the squeaky wheel where, sure, they might get tired of hearing from you, but I guarantee you at some point, they will sit down and listen to you because they want you to stop reaching out to them. So, Cammie, I'm really sorry about your experience and about not being heard.
Thank you. And I really appreciate that, Marianne. And I'm going to keep fighting along with all of you for better care for all of your kids.
Well, on that note, I want to thank everyone for joining us. I mean, MHAM is going to continue to focus on this issue, and I think we need to do more. I wasn't aware until a few minutes ago, last week, how severe things were with Hawthorne and Walter Reuther. And I think that one of the things we're going to be doing is writing some letters to kind of ask why are things so bad at the, for these kids, which is the last thing that they need, is to be placed in a setting that's certainly not going to promote healing. Yeah. And you know what? I don't know how to answer your questions about, it's a very difficult thing. How do you tell your story without IDing your kid? That is very difficult. And then I understand the flawed administrative complaint process too. I really understand that parents get blamed for things. And then instead of a resolution or a solution, it's more about the blame game than it is about solving the problem. And that is a big problem. And I want to really acknowledge that. So, but I want to thank Rachel and Michelle and all of you for joining us today. And we will just continue to fight the good fight.